My name is John Arvesen, and I specialize in sports medicine and shoulder reconstruction here at OrthoTexas. I'm a homegrown Texan. I grew up in Dallas, Texas. I went to high school here, and then for college I went to Baylor University and then University of Texas for medical school. I actually got interested in orthopedics at a young age. I had a bone tumor in my right leg and was actually treated at Scottish Rite Hospital downtown Dallas. There was a physician there who really took me under his wing and took care of me, and everyone was so kind and really cared for me and our family. And I was able to go back year after year in high school, college, med school, even during residency, and work with some of the doctors down there. And just their compassionate care and the way that they took care of people from all walks of life inspired me to go into orthopedic surgery. I grew up playing tennis throughout my life competitively, and I had active interest in all sports and athletics. In high school, I was part of 3 state champion tennis teams and was the runner-up in doubles tennis twice, back-to-back years. And then in college, I had the opportunity to walk on for the Baylor University men's tennis team and was a part of 2 Big 12 season and tournament champion teams. I've also been active in USTA men's tennis after college and have been playing recreationally ever since. I like working with athletes. I spent a lot of time in fellowship working with athletes at the highest level. We also spent a lot of time with patients that were just weekend warriors or people that did tennis, golf recreationally. Being a tennis player myself, I have an active interest in the overhead athlete and specifically getting tennis and golfers back to their game. During fellowship, we had the opportunity to work with the Colorado Rockies, work with some overhead throwing injuries and as well as baseball related injuries. We also had some professional basketball players that came through our fellowship. OrthoTexas to me is a great advocate for the local community and getting you back to your sport, getting back to full motion, full function. My philosophy on patient care is I think it's built on a relationship and trust between me and the patient. One of the joys of medicine for me is to be able to talk to people and get to know them on that personal level right away. I like getting to take care of the high school athlete. We get to get players in their most intimate, vulnerable moments when their senior season's on the line and they're not sure if they're going to get to play, and we get to treat them, care for them, get them back on the field so they get to do the things that they love to do. That to me is an honor that I get to be able to do that and be a part of that process, whether that be working with the head coaches, the athletic trainers, or even the parents. My goal is to get each patient back on the field as quick as possible and as safe as possible. I have a wife and 2 children. In my free time, I enjoy playing tennis, running. I just started to get into road cycling, which has been really fun, and volunteering. Young Life is a high school-based ministry. I also have an active interest in global health. Currently, I am serving on a committee for education curriculum for the Pan-African Academy of Christian Surgeons as a sports medicine contributor. Me and another sports medicine trained physician are currently creating the curriculum for 3 universities in Africa on their sports medicine lectures and techniques. Currently, we discuss cases with them. They'll send X-rays, MRIs, and ask us for help on how to do a certain technique or procedure, and we're currently in the first year of that program.